Chorionic Villus Sampling, or CVS, is an early diagnostic test that collects a small sample of placental tissue to assess for genetic and chromosomal conditions in the fetus. It's one of the first diagnostic options available in pregnancy. CVS is typically performed between 10 and 13 weeks of pregnancy, which allows families to receive early results and make timely decisions when there's a risk of genetic abnormalities. The procedure uses ultrasound guidance to collect chorionic villi, tiny placental projections that carry the baby's genetic material. The sample can be taken through a thin catheter via the cervix or with a needle through the abdominal wall, depending on the location of the placenta. If the transabdominal approach is used, a full bladder is required to help lift the uterus into view. This bladder prep is an important procedural detail that often appears on exams and helps differentiate CVS from amniocentesis. CVS helps detect conditions like trisomies and inherited genetic disorders, but it does not test for neural tube defects, which require amniocentesis and alpha-fetoprotein analysis later in pregnancy. Although generally safe, CVS has a slightly higher miscarriage risk than amniocentesis. There's also a chance of infection, cramping, and Rh sensitization, which is why Rh-negative patients should receive Rho-D, immune globulin afterward. Nurses are key in preparing patients, explaining the risks, and offering reassurance. Post-procedure, nurses monitor for bleeding or cramping and ensure Rho-D, immune globulin is administered when indicated. Like and subscribe to RN Toolkit for more nursing videos.